is sorely lacking. The time is now to move forward. It's to move forward with the research that really needs to be done. It needs to be done collaboratively. It needs to be done in support and with the Ontario Trillium Gift Flight Network. That's a commitment that we made, and it hasn't been taken up yet. And hopefully today, this will change things. The education needs to happen. Public isn't aware. For somebody to assume that this would not be accepted is a wrong assumption. George says 1,000% times worse than ever. It might be more than that. It's not all about presumed consent either. This is something that has to go through a process. There are 23 other countries in the world that actually practice presumed consent. Canada doesn't have to be there at one step, but it needs to move forward. We made recommendations in May and June as to how to move forward. We were hoping, at least from those meetings, that some of that input would have been helpful in determining the next step for the foundation to move forward. Last week's announcement just ignored it. The public needs to be involved, and by whatever means it takes and is necessary for us to take, to find the funds to make that happen, we are going to move forward. Hopefully it can be collectively with the current government, but if it can't be, we're going to move forward anyways. The people are going to have the right to speak, and nobody should speak on behalf of other people on this issue until they've had the opportunity, number one, to be educated, and number two, to have the right to voice their opinion. And we will make that available to them. And I'm not going to say much more except for that I'm here to help George, and I will continue to do that. And, hopefully we can move forward. I guess it takes a survivor to understand how significant this is. And when we know that there are 4,000 persons right now waiting for organs, and day by day people die who these organs could be obtained through and from. And I'm sure, if given the opportunity to have that decision, might have made that progress. So, in closing, I just want to say I'm here to support George, and we'll move forward.
Thank you, before we start the questions, I want to recognize the leader of the Ontario MVP Party, Mr. Howard Hampton, for joining us in the audience. Thank you for coming. And with that, we can open the floor with questions. What is the Spanish model? The Spanish model is a system that has been used widely, the term, by many countries, especially the ones that adapted similar systems. In 1989, they passed a law where everybody became an organ donor unless they opted out. But as Barbara mentioned, and we're going to keep on mentioning, it wasn't the only part of the Spanish model. As well, they organized special teams at every transplant hospital to not only comfort the family that was making the donation, but as well to take any vetoes from the family members. And I have statistics, because I recently came from there. During the time that this law has passed, there's been a minimal amount of family members that have vetoed the decision, and so that's the other part of it. And as well, they incorporated the non-heart beating donations to retrieve organs. In Canada, we're still practicing with brain dead only, and as a result of incorporating the heart dead donations, there was increases anywhere from 20 to 50%, and similar results were shown in other countries that adapted that procedure as well. And there's other factors that increased the rate of organ donation. So it became more of an attitude and perception, and how the country made that issue a priority. And the 23 other countries that had adapted similar systems has shown the same success. So that's why we refer to the issue as Spanish model as opposed to presumed consent. And presumed consent, in other words like negative option, it kind of leaves a negative word in people's minds. So for a headline to be, you know, will you support negative option and not explain the rest of the story, it's not fair. So hopefully one day we can change that word to a more positive word, because that's what it is, positive.
What are the rates of donation?
Here in Ontario or in Canada. The rate of donations, I don't have the latest statistics, but I can tell you this, that Ontario is one of the lowest in the world. And, you know, we shouldn't be there.
Why is that, in your opinion? Why do you think Ontario's rates are so low?
Well, I think we haven't really made this issue a priority. Where in the 1980s, Spain had accepted transplants as a cure, and they took that literally. And the government, the present government at that time, the king, they all made the issue a priority in their country, because they had the mindset of what could be more important than utilizing a cure, and that will save lives. As a result of making a priority, they went to work on developing the best system. Here in Canada, we haven't reached that issue yet with our government officials to make it a priority, so we can give it the attention that it needs, so that Canada can maximize the potential available organs. But we're getting there. I think as in Ontario and the rest of the country, we're realizing that the potential of saving thousands of lives should be a priority, and that eventually we're, you know, hopefully we'll have the best system we can possibly have. So it's a matter of what is our priority? Do we want it bad enough here? And just from our research and everything, the public does want it bad enough, but we gotta get the politicians to understand this. Sure.
I'll add to that. There are a couple of things that could happen that are very simple, already in place, so it doesn't involve creating new bureaucracy to handle this type of issue. For example, right now, we have an opportunity when we get our driver's license through an organ donor card to indicate whether or not people want to be involved, and if so, how and for what part of organs you might want to be involved. We made a recommendation that why would we not attach it to the health card? The health card now is on an automatic renewal system. Once you get rid of those old red and white ones, which is coming, you're into a photo ID health card. Why would it not be at that time? Every single time that you have to go in and renew a health card, because it's there anyways, and you have to be there anyways, that you would not be asked the question. Even if that's the step-by-step method. If governments can't get their mind around going the whole way to a presumed consent situation, and have to step their way through it, and maybe that's what has to happen, then one easy, simple way to do it would be a system that's already there through the medical health card. Everybody has to have one to be treated. And guess what they look for when you enter a hospital and you're dying? They look for your health card, because they have to charge it back to something. That kind of simple recommendation was made. It didn't even come out of the report and the research that was announced last week. It's just no. And that doesn't make sense to anybody. I mean, when we go around and we talk about it as a first step, would that not be something that could happen very easily? Everything is in place to make it happen. But it's falling on deaf ears. I question, where is this money going? Where is the advancement that we expected to see to take place? It doesn't matter what government. It's there, it's committed. But somebody do something productive with it. That's a simple step. So the tools aren't in place is one of the reasons why the consent ratio isn't higher. The education is not there. I think George said it best when he said the public isn't aware. It hasn't been addressed. It's not an issue that is put in front of you that often that makes you make that determination whether or not you want to be involved. And it needs to be.
George, can you say and spell your last name?
George Marcello, M-A-R-C-E-O-O.
And what's your title, George?
Founder and CEO of Step by Step.